feed a cold and starve a fever, or is it the other way around? There's a treasure trove of lore that surrounds our health, myths in medicine, Dr. Google and alternatives, good and bad, tonight on Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. In the words of Jonathan Swift, falsehood flies and the truth comes limping after it. For some reason, people tend to believe the myth but resist the reasoned response. Our discussion will sift and winnow for the truth. First, let's take a look at this week's Prairie Doc quiz question. It's a multiple choice tonight. Choose the best answer. Delirium is best treated with 1, hand-holding, 2, an anxiolytic like Ativan, 3, a major tranquilizer like Haldol. Viewers who call in the correct answer will be entered into a drawing to win a signed copy of our book, The Picture of Health. Each of my essays, originally written for this show, comes with a wonderful accompanying photograph by Dr. Judith Peterson. We'll announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get your answer on the quiz question in. But all night, we will answer your questions about medical myths as they are called in or sent to us via Facebook or email. Call in questions or comments to 1-888-376-6225 or send us an email to the address on the screen. Joining us tonight are Doctors Candace Zeigler and David Zeigler of Sanford Internal Medicine Clinic, Sioux Falls, South Dakota. Thank you both for joining us.
It's great to be here.
It's
It really is.
Pleasure to have you here. And of course, we're tackling the issue of myths. And so in preparation for this, we asked the Zeiglers and we asked the board, the physicians on the board, and we asked our hero board physicians, what myths would you like to hear us discussed and debunked? And we have 60 quiz questions or myths that are put in our fishbowl tonight. And we thought we would, aside from your questions and comments, we would pull it out of the fishbowl. First one, milk and wheat allergies are common in adults. And you know what? I think we're going to get that. Is that true or false?
False.
False.
Okay. And you know what? I'm going to go for, there's some allergy ones that Dr. Buback is going to talk about in one of our roll-ins. And here's another allergy quiz question. Here is one. ALS, amyotrophic lateral sclerosis, was a condition that affected Stephen Hawking and Lou Gehrig. We are now able to define the cause and treatment, allowing Hawking to live 50 years with the diagnosis. We don't know the cause and any treatment. So what's the answer? Do we know the cause? Do we have good treatment? He lived at 50 years.
He was lucky. We do not know the cause, and the treatment is supportive care.
I don't know why he lived so long. I don't know. Most medicine, no one knows why he lived so long.
He was diagnosed in 1963, and I think he had excellent care. And it probably wasn't as an aggressive disease in him as other cases, yeah. So his was an unusual.
The average case of ALS, no matter what we do, their muscular strength gets worse and weaker and weaker and weaker, yet they stay alert.
Yeah.
And they live, what's the average time? Do we have an idea? 5 years?
5 years, I think.
Yeah, I would say 5 to 10.
Yeah.
So 50 was way out of the norm.
Okay. We have physicians die earlier than people of other professions.
I don't like this thought. I mean, but no, we don't. We actually live longer in many ways. I think it's the things that determine how long you live are partly genetics, and then partly being involved and active well into your 80s and 90s. If you're active and have things that you're involved in and interested in, it will keep you alive.
They've actually done some statistics on this, and both white and black physicians live longer than, say, lawyers or
Which
general
makes me happy. No, I'm just kidding.
or general professionals.
I have good friends who are lawyers, so I was just kidding. Okay.
Good going, Ray.
Yeah.
So there we go. I have allergy testing is dangerous and inaccurate and should not be performed in young children.
That is a no. It is very safe, especially when it's done by bona fide allergists who know what they're doing. It's a perfectly safe thing to do.
It's perfectly safe, although they are prepared for a severe allergic reaction.
Right.
Yeah, that's why you want to go to somebody who knows what they're doing when you have
When
the
you have
testing
your
done.
allergy testing.
Yes.
The cost of health care has rocketed up in the United States because of excessive cost of medical therapies. Excessive cost of medical therapies. What would be the reason the cost of health care has gone up?
I think it's the number of tests that we do, and I think it's also the expectations of patients that they want everything done, and they are unhappy with a lower expectation.
Well, the cost of everything has gone up. So I don't think it's just, it's not just medicine, it's everything we do. It's the cost of the people that, the nurses and the doctors, you know, their fees. It's the cost of all the tests. It's the cost of the people that, you know, mow the lawn and, you know, keep the place running. Everything, the cost of everything has gone up.
Cost of a candy bar is rocketed. If you look at the, you know, when I was a kid, it was 5 cents.
Yeah.
Now it's now it's
don't know what
$1.50. I think.
But I do know this. I read an article in the New England Journal of Medicine the other day, and they talked about the fact that the price is so much higher, and the price is higher because third-party payers, the insurance company, the government,
Bargain with
the
healthcare system.
healthcare system, and they say, how much is appendectomy? Well, it's $500. Well, we're going to only pay you $250. Well, the next time they come back, how much is the cost of appendectomy? It's $1,000. Well, we'll pay you $500. Well, the next time they go, well, that was easy. It's $2,000. And that's what's happened. We are twice as expensive price-wise for everything we do in our country than all the rest of the 10 next most wealthy countries of the world.
But we
And
also
yet-
get great care, health care here too.
Yeah, and people want to come to the United States to get their health care.
They do. I love throwing these over my shoulder.
I would say, just to that point about, you know, our health care is expensive, but only in America can we have a test, order a test, have it run that day, and get the results that day or the next day. I mean, it is just incredible what our patients expect and get.
Yeah. Some people live forever.
Haven't met one yet.
Children will outgrow their allergies.
No.
We have, and what was it?
Carmack?
Carmack, the great Carmack. Sorry. Ancient Orange. There's a lot said about Ancient Orange.
Agent Orange.
Agent. Orange.
Agent.
Yeah, it's ancient, but
Ancient Orange. Agent Orange is a vegetative poison that was spread in great quantities in the fields and forests of Vietnam during the war in the 70s, and it has been considered to be so detrimental to the soldiers that Agent Orange has been banned for use in most countries since. Okay, and the question is Roundup the same as Agent Orange?
no, it is not. Made by the same company, I think Monsanto, but it is not the same.
agent.
No.
But it's a cousin.
Right, but
But
it's not a killer of humans.
Of people.
Yeah, of people,
And,
yes.
but is Agent Orange a killer?
I think it, you know, I do have a lot of people who have had problems following Vietnam, and a lot of the Vietnamese living in their country who
Have health
also
issues related to it.
that as well.
Yeah.
So I think it has caused some health issues, but I'm not
I
sure.
don't think mortality maybe, but health issues.
Well, do you know that more than half of the people, this is like 5 years ago, I looked at it, more than half of the Vietnam vets are dead. The mortality rate for the Vietnam vets is much higher than for those of us who didn't go. And when you don't know the answer, sometimes you think
Blame it on Agent Orange.
it could be Agent
Yeah.
Orange. There might be other reasons. People with sinus and ear problems should avoid milk.
No.
No.
I'm not even sure where that came from. I think people say they drink milk and they get mucus in their throat or something.
I remember when I was a young child, I went to a non-physician practitioner who said, you're going to have to stop drinking milk because I had asthma, that the milk was the cause of the asthma.
Oh.
It was
okay.
not.
No, it wasn't.
Endometriosis is an uncommon cause of severe and chronic abdominal pain and pelvic pain in women. Is it?
That is not true. It is not uncommon. Like 11% of women have endometriosis. Sometimes I think that diagnosis is harder to come by because there's a lot of things that cause abdominal pain. But 11%, that's not uncommon.
And there's a new drug to treat that now. I can't remember the name of it, but I've seen that there's a new drug out there
Aralisa or something like
Aralisa,
that.
yeah, that is available to treat endometriosis. Yeah.
Well, what is endometriosis?
So it's the cells that line the uterus that get out of the uterus and are growing in other
Within
areas.
the abdominal cavity.
Right, right.
They follow up
And-
the fallopian tubes and go out to the
pelvis and abdomen, and they can
grow.
Yeah, they can grow outside there.
And then when the menstrual cycle comes,
It's-
they bleed.
That's
Yeah,
right.
and they're
And it
painful.
causes pain. So it can be very debilitating for women.
So it's a common cause of chronic
Yeah, it is.
chronic pain,
Yeah.
recurring, severe. And they say the most important treatment for it is pregnancy. Have you heard that?
Right, right. Well, that's one, yeah. To get a definitive diagnosis, I think they do a tissue exam, but you can also tell by some physical exam and ultrasound and stuff.
But I've known women who've had, it's been so bad they've had to have a hysterectomy because of it.
Yeah. Multiple vitamins have improved longevity because many people don't eat balanced diets.
Wrong.
If that was only true.
I mean, most people eat more than they need.
They need.
But I do, people think, oh, well, I'm not eating a healthy. The only people are perhaps some of the elderly who are not getting a good balanced diet. But if you eat normal vegetables and fruits and meats and carbohydrates,
Some
A
starches.
balanced diet.
you'll get all the natural vitamins you need, probably in a better source than a vitamin. I just remember early on they used to package these horse pill vitamins.
Yeah.
And they would never actually break apart, and so you wouldn't even
Be
get the
pooping
vitamin.
them out.
Yeah.
Poop out your multiple
Yeah.
vitamin.
And there's no evidence that it causes, that it has
Benefits you.
benefits longevity.
The woman study, like 35 years of it, they looked at massive, thousands and thousands of women who did and who didn't, and there was no
No
difference between
change,
them.
yes, in their mortality.
There was a difference in the women who had a glass of wine a day. They had 20% less heart disease in the women's study.
Just one glass of wine, not multiple glasses.
That's right.
Yes.
It's not to say that I'm promoting alcohol, but at the same time, if it is not a problem for you, a glass of wine,
It's not a problem.
no,
And can be helpful.
can be helpful. Now, there's some disagreement. I've read some disagreement of late. One article that just came out, but there's multiple articles in favor. One article just came out negative, and of course, that's what they do.
And that's a glass of wine. That doesn't mean a beer or doesn't mean hard liquor either.
Does it mean grape juice?
I don't know.
I don't have the answer to that
Yeah,
either.
I don't know.
The studies said a glass of wine.
Yeah.
Pills can often do more than lifestyle changes. Of course, you know whose question that was.
Yes.
That was
yes,
mine.
that was yours.
Yes.
And I would say that lifestyle changes should always be promoted. Patients like to come in, and the easy thing would be just give me a pill, but really, they need to make changes if they want to lose weight, if they want to get in better shape. Pills are not going to give you energy. They're not going to promote healthy bodies and
I tell people, rather than start this pill, whatever, why don't you lose 20 pounds? It'll lower your blood pressure, it will lower your cholesterol, it will lower all of the other problems you have. I mean, there are definitely diseases that need to be on a medication, like thyroid disease, whatever.
And hypertension.
Hypertension, but
diabetes, but even diabetes, the basis, underlying basis
Is
for
obesity.
treatment is, well, but the
Weight
underlying
lifestyle
treatment
changes.
is lifestyle changes.
Yeah.
And sometimes if you're really serious about it, they can last for quite some time before you have to be on a medicine.
Right. I can't tell you how many people who've come in, I've made the diagnosis of diabetes, I get them on a walking program, have them measure how many calories they're eating
Lose a
every
little
day,
weight.
reduce your calorie intake, increase your walking amount, and the diabetes goes away.
Yes,
Yes.
yes. And we try to promote that when they're pre-diabetes so that they never even progress to diabetes.
Right. There are a few areas of medicine that have more myths. There are few areas in medicine that have more myths than allergies. Let's hear this.
Actually, we grow into our allergies. Genetics plays a big role into that, along with our exposures and infections that we come across. Actually, a positive allergy test often is wrong. There's about a 50% false positive rate. Additionally, soybean is one of those allergens that we often outgrow. Actually, fatal food anaphylaxis is a real problem. Some people talk about food allergy and they really don't have the same thing, they dislike it or such. If you actually have anaphylaxis, it's critical that we avoid that food and we have epinephrine on hand in case of an accidental exposure. Actually, nowadays, patients with egg allergy can take the flu shots as the egg part is really out of it. Hives, also known as urticaria, certainly can be caused by allergy to food and other things, but so many causes of hives aren't allergy and include an infection, things like sunlight, heat, cold, vibration, viral, bacterial infections, and autoimmunity. Actually, food allergy is more likely to cause anaphylaxis, more of a multi-system reaction. Nasal allergies are caused by things we breathe in, so it would be pollens, molds, danders, dust mite types of things. That is, unless you're putting the food up your nose. Local honey really doesn't do a good job because the dose of the pollens that you're getting is way too low. That's why a lot of the drops under the tongue don't work very well either. But I have to say that this is one tasty treatment to try. Sinus and ear problems are due more so to inhaled allergy problems, plus viral and bacterial infections. The milk sometimes gets blamed because of mucus, but avoiding the milk really doesn't fix people up. The indoor plants have pollens that don't go very far, and we really don't have much for mold growing on them. And it's the stuff outside that overwhelmingly gives us our symptoms. Essential oils have definitively been shown not to help allergies and asthma. In fact, though, essential oils are great allergens of themselves, giving contact dermatitis, rashes, and for most allergy and asthma patients, the irritation from the smell will further set things off.
This is your program, and your questions are key to the direction of our discussion. I know it's a different topic, but I'd like to hear your comments. I'd like to hear your thoughts. I'd like to hear your questions. Call in the questions to 1-888-376-6225, or send us an email to ask@prairiedoc.org. Thank you. So,
I wanted to just touch base. He just mentioned egg allergy.
Yeah.
related to vaccinations. Flu shots, and MMR is another one that
Right.
they always say, I can't do it. And it's just good to hear that that is a myth.
Right.
It's hard to get that across to patients that say they have this egg allergy.
Yeah.
There is minuscule, if any, egg protein in the vaccinations anymore.
Well, and there's, there's the myth that the flu shot will bring on the flu. I mean, it's a dead virus.
Yeah.
Right.
So
Sometimes it's not even a whole virus. It can be just viral
people say,
cold.
well, I got the flu after I got the shot. No, you didn't get the flu after the shot. What you got is the allergic reaction of your body to that virus that...
Which is good.
Which
Yeah,
is good. If
yeah.
you didn't, and just think how much worse it would be if you actually got the flu rather than the virus.
Yeah.
In comparison, people don't recognize just how bad you feel when you get the actual flu.
Right. Well, what about hives? The hive shot. People talk about, not the hive shot, I mean the shingles.
Shingles?
Shingles vaccine. Some say, oh, but I got shingles right after I had the shingles shot. Will you get a shingles?
No.
So there's a new, the Shingrix, the newest shingles vaccine.
Yes.
It's supposed to be 97% effective. The old Zoster is maybe 50 to 70% effective. So people could have had that Zoster vaccine and still
still
gotten
had the-
shingles.
Yes.
With this new one, there'll be less secondary shingles after, I mean, 97% effective. That's
Yeah.
going to be great.
But there's a shortage of it.
Of course, yes.
Because
Yeah.
Everybody wanted it.
Yeah.
I got mine.
I haven't had mine yet. I had the old Zostrix.
Uh-huh. Well, get this one though.
Yeah.
Yeah.
When
it's available.
When it's available. I'm old, you know. Of
We
course
all
you
are.
know. The ketosis or ketogenic diet is the best way to lose weight.
Oh, no. That's absolutely false. I know that you lose a lot of weight when you do, initially. When
Water weight.
Water weight, when you start on that ketogenic diet.
Which means no carbs, so
Yeah.
you get
Yeah, basically,
ketosis.
you're trying to get the body into ketosis so that it burns not only ingested fat, but your body fat.
Right.
And when it does that, you also lose fluids, and sometimes just because of what you're eating, which is 70% fat in a diet, not
That's-
the healthiest
No, I mean,
thing.
you have to turn to fat
Yeah.
because all there's left is protein and fat.
Right,
I mean,
right.
if you don't have
you have like 20 grams of carbs is all you're allowed
Yeah.
on a ketogenic diet.
It eliminates fruit, which is,
Yeah.
Wrong.
one of the very best.
And the best diet
Fruits and
is
most vegetables.
a diet high in vegetables and some
Fruit.
fruits, and then
Fiber.
some fiber,
Fiber,
and also some protein in form of eggs or meat, and a lot less, and then less carbohydrates. So, but
Yeah.
but you should eat
Well, the
things
simple
like
carbs.
simple
Yeah, you
like
the sugars, the
but you
bread,
should
the
avoid those.
corn.
Yeah,
Right.
but I think like sweet potatoes and other vegetables like corn, carrots and so forth are great for you.
Oh.
Well, and I think there is nothing wrong with things like potatoes and rice and noodles.
In
The
limited
problem is the quantity we eat them.
There it is.
It's restaurant portion size that
Yeah.
we're used to.
Yeah.
So I went out for supper with my wife and daughter about a year ago, and I was measuring calories in the food, and she had a salad with crispy chicken in it, and I had one of those low-calorie diets that Applebee's was promoting, and I had 350 calories and a beer, while the beer was 120. Okay, so and she had 1,300 calories in
'Cause
her
it was
crispy,
fried
deep
chicken.
fat fried chicken,
Yeah.
crispy, It was amazing. And the salad dressing was caloric. Amazing. You've got to look at the calories.
Yeah.
Yes, yes.
So it's a balanced diet, you're saying. Lots of fruits and vegetables, fiber, but less calories.
Right.
And combine that with increased exercise.
Bingo. You need to wake someone up every hour after a concussion to check them out.
That is no longer true.
It used to be.
Well,
that's the way
and
we
I
used to
think
treat 'em.
I think you have to clarify that by saying you want to make sure that they're checked out by a physician or somebody who knows about concussions.
And a neurologic exam. How can do a
Right,
neurologic exam?
to just make sure that they don't have a bleed. And if it's a safe concussion, then sleep is actually good for them. It helps with healing.
But one thing, they should never get another concussion within the, a certain time period, or avoid a second concussion, because that's terribly damaging to the brain. So they need to avoid concussion.
Sports for 2 weeks.
Yeah.
For 2 weeks at least after they're normal.
Yeah,
Right.
after they're
Right.
normal.
Yeah. We have some questions? Thank you. A woman from Brandon asks, what's the relation between eating lettuce and having diarrhea and have excessive bowel movements? Is there a leafy green that doesn't cause such side effects? I'll give you a story. A friend of mine said he couldn't eat leafy green vegetables. It gave him diarrhea every time. Found out he had gluten intolerance, and as soon as his gluten intolerance was treated by avoiding gluten foods, he could eat all the leafy green vegetables he wanted. So I think it's important that you get checked out.
Well, and lettuce seems like such a benign thing. It's like 90% water, but some people have a lot of trouble with that. You can either try a different kind of lettuce and see if there's one that you're more tolerant of,
Yeah.
or switch to some of the other greens.
And check out your diarrhea. Chronic diarrhea or recurring diarrhea deserves an evaluation by a physician
Yes, it
who's
does.
competent in that. Just because you may have sprue,
Yeah.
you could have. So a Sioux Falls woman asks, I'm a person in clinical psychology. There has been lots of talk about CBD oil being a magical cure. Pros and cons, can it be dangerous?
Short
Are you willing
answer,
to
yes.
address?
No. I don't. I think any of those oils, I think, can be. I think it's a marijuana derivative, and
Yeah.
so
Yeah.
it's. I do think that we don't know enough about marijuana to say that it's safe.
Or the oils.
Or
really.
the oils
I don't
either.
think we've had any studies about use of these oils.
The problem is
It's anecdotal.
They made it a level 1 drug that
They couldn't study.
You can't study it.
I know, it was the stupidest thing to do about a drug, and I think there are components of marijuana or those drugs that would be useful for medicine, but because of the way it was marketed initially, they never actually developed them.
So how many people do you think, something like 70,000 people died from opioid overdose in 2017. How many do you think died from marijuana or CBD oil?
Probably
I
varies.
doubt if there's been any
Everybody.
deaths
Yeah.
from that.
So
But-
we think about it as an option for pain.
Yes, yeah.
So I will tell you this. Today I had a phone call from a dear friend, a physician friend of mine who trained with me in Emory. And I cut you off. I'll give you a chance to come back. who had severe chronic pain, and he said, and I got relief with CBD oil.
Yeah. I think there is a place for it.
But
Yeah.
I think
It
you
would have
have
been
to-
nice if we had studied it a little more to be able to promote it if it's helpful.
If it's helpful.
Yeah.
So
But I think there's a lot of use of marijuana, and that is also a problem for a lot of young children.
there it is.
And that is not, or adults, that it does affect you mentally. And I think that's something, we tell people don't smoke, don't drink excessively, and yet it's okay to use marijuana. No, it's not. I think you have to do things that are appropriate, so.
My comment about that is that certainly if it were legalized, we could have a better control on the use, because I think it's very dangerous for the youth in their developmental. They're just not aware of some of the things that you have to learn when you're young, and we could do better, perhaps, in that regard.
But I don't agree with Colorado, where they have basically recreational use. I think it's not a particularly useful way to do it.
Okay. Lot to learn on this one, though.
Yes.
Yeah.
A woman from Flandreau asks, I have an allergy to petroleum products and has skin reactions. How common is this allergy or these kinds of issues? And I have to say, I don't have a good answer.
I don't either. I don't know.
But we have an allergist in the house, in the back room. He says, very uncommon. Well, it doesn't mean that it isn't there, though.
Right.
And I don't have a great answer for her. I wonder if Mark could give us a better answer, but we're going to take this roll in, and we'll hear from Mark afterwards. Sadly, even after a myth has been debunked, they hang on and negatively affect our health.
Well, one of the biggest medical myths that we're dealing with is just the issue around vaccination, that vaccines cause autism. That myth has been debunked. Andrew Wakefield and the study that he published in Lancet has been retracted. There have been a large number of studies that have gone on to since identify that there is no link between vaccination and autism. Yet, that perception still exists within the community, unfortunately. I think you have individuals who are impacted negatively by
Autism, for example.
by autism, and then they're looking for some outlet for that. They're looking for a cause. They're looking for a reason, and this offers one of those reasons. I think there are a lot of people who look into the tea leaves and think that there's Big Brother, manipulating vaccinations, and that just is not true. The thought was that you'd pop a pill, you'd get all your probiotics, you would, wouldn't have to go out and physically exercise, and we're not seeing that. There's a multi-billion-dollar industry dealing with weight loss supplements and things along those lines, and most of them, are debunked. There's not a lot that it does to really help you. What we do know is that diet and exercise are the two biggest things that you can do to really be healthy.
I thought that the last comment about you only use 10% of your brain, that's not true?
No.
That your brain is constantly going with...
100%, yeah.
And now we have imaging to prove that.
Yeah, that's amazing. I didn't know that. That was a nice little blurb. I do think that there's a lot of potential use of the brain that we don't have. This whole frontal area, this big frontal cortex, we don't know what it's doing up there. I mean, you can have, so anyway.
We always need to stress our brain, or at least stretch it out to learn new things at any age.
I think that's really true. That's really true. Heartburn is mostly due to reflux acid back up into the esophagus and can be caused by too many nonsteroidal anti-inflammatories like ibuprofen. No disagreement with that, not a myth. And can be easily distinguished from the pain of a heart attack.
No,
That's
not
the problem.
true.
There, it can be the very same sensations. You can have a heart attack going on that you keep thinking is just acid reflux.
Yeah. So I've been tricked by reflux, and I thought for sure heart attack was a reflux problem, and I've thought a reflux problem was a heart attack.
Yeah.
I think the bottom line is you have to say which is the killer. It's the heart attack, so you want to make sure that's
Stay on
not
the
what's
side
going
of safety.
on.
Yeah.
Right.
We have a call from Pipestone Man who said, is fish oil of any benefit when you're allergic to eating fish? That's a really good question. And I guess my answer depends upon what is his allergic deal. Oftentimes it's iodine. And we can ask our house allergist, although I think I just saw him.
I don't think there's much
Actually,
iodine in fish.
In fish oil?
No.
Well, and also I was just reading about that fish allergy.
Yes.
It's probably not the iodine in the fish. It is some of the proteins in the fish that is the allergen.
And if we've been able to get the oil out, then
It's not going to be a problem.
It isn't a problem. It just depends.
I don't think taking fish oil, though, will help with your fish allergy.
It's not going to make the fish allergy
go away. No.
No, and I'd be careful with that first fish oil test. I'd take the fish oil rub it on your forearm.
Yeah.
You know, break the and see if you
See
have
if you get a
any reaction.
rash.
Although they have done a study to look at fish oil in reduction of heart disease, and there's not been a real
ton of it.
No.
No.
No. Although there is data from Denmark that showed that fishermen, or I mean that people living in Denmark, great number of men eating heavy amounts of fish versus men not eating any fish, there was a reduction in heart
Is
disease.
that because they were more active fishing?
Maybe
Yeah.
could be. It may not have been fishing. The point I'm saying is, it's likely not the fish oil capsule. It's the fish.
Yes.
Yeah.
Yes.
It might be the protein. We don't know.
Yeah.
We have another myth. You will get addicted to your blood pressure medicine. Is that true or not?
No.
What?
When you are on a blood pressure medicine, we don't cure
Blood
hypertension or high blood pressure.
We just control
We
it.
just control it. And I think that's what some people get mixed up. They think, oh, well, now my blood pressure is good, I can get off it. And then when their blood pressure goes up, they think, oh, I'm going to get addicted because I can't get off the medicine.
Yeah, and they can get off the medicine if they would increase their exercise, reduce the quantity that they eat. And my comment is, whether you lose weight or not, if you eat a lower calorie diet, a balanced diet, and you exercise, chances are that blood pressure will drop, and then you can try getting on less medicine.
Right.
Well, and
Not everybody can get off their medicines,
No.
The
but
goal of every internist is to reduce the number of medicines you have to take.
Well, the role of every good internist.
Well, whatever. But
There are people.
it's a good day when you can take someone off a medicine.
It's a good day.
Yes.
One woman states, I have heard that warts and other growths can be treated with masking tape. Is this fact or a myth?
Myth. I have not,
I'll counter.
I think warts are one of those weird things that
You know-
sometimes you can cover them. I don't know if it's blocking its oxygen supply or what, but
I tell you, I have had success, but of course, who knows? I mean, the chances are that nothing works.
The problem is warts will come and retract at times too.
Right.
They come and go, and so.
well, and that myth. Well, you just pick it up and toss it over your shoulder.
Yeah.
That one is a myth.
That's a myth. But I've had success using just
Duct tape?
duct tape. And I think
I
it
wonder if
starves it of oxygen.
Yeah, I think that might be.
Yeah.
And there's some data on that. And there's data on banana peel. So I've had people take ripe banana peel, cut it dime size, riper the better, gooey side against the wart,
And then wrap
Duct
with
tape.
duct tape.
duct tape, and they get success.
Well,
Honestly.
and it's not going to hurt them if it doesn't succeed.
If you go to the dermatologist and they use the laser treatment, it's thousands of dollars. The insurance oftentimes doesn't pay. And so,
And sometimes the warts come back.
I asked a dermatologist about the duct tape. He suggested the duct tape. He said, he says he hadn't heard the banana peel one. A woman from Sioux Falls asked, my husband went to the doctor in November and has had a virus in his ears. The doctor said the virus needed to take its course. Went back a month later, the doctor said he didn't wait long enough. Went to an ENT, and that doctor said he waited too long. Now he has to get tubes in his ears. Are tubes common for old people? You know what happened. I mean, he got an infection in there and
Yeah.
chronic
Right.
scarring.
Yeah.
I don't know that tubes are common, but certainly it's not just the children that need them.
Yeah.
Well, and you get a retraction, the eustachian tube is not functioning.
Yeah.
Right.
And so you don't have an air into that pocket, and it withdraws, and then it scars the tympanic membrane. If you can put a hole in the tympanic membrane.
It opens up the.
And it's an
area.
office procedure. It's not like a big surgery.
One listener asks, is it true that it's not worth having a cyst removed, like a Baker's cyst behind the knee, because it might grow back? Are you familiar with Baker's cyst?
Yeah. But I don't do anything about them. I mean,
I
there's.
think a Baker's cyst is an indication that you've got problems with your knee joint.
Right.
And taking a Baker's cyst out isn't going to fix it.
Right. So what a Baker's cyst is you've got a synovial sac.
Right.
right? And it pushes
Just
out
out.
backwards
Yeah.
It's
behind
kind of like
your
a
knee.
hernia.
Right.
Yeah.
Kind of like a hernia because there's inflammation.
Yeah.
Right.
And so,
So you reduce inflammation.
You don't take away the cyst won't take away the problem.
no. So sometimes you need to fix the knee.
Right.
Right.
There it is. And I think that's the best answer. Time for another myth.
Okay.
Here is one, and it says, that's a food allergy one. We had Dr. Buback do that one. Delirium can be treated by anxiolytics. That's the quiz
Oh,
question.
that's a quiz question. We better should we talk
We'll
about
leave
it,
that
or-
alone.
Oh, okay.
You need to wait an hour before going swimming.
My parents told me that when I was a kid. I think they just wanted more time before we had to go to the
Right.
lake.
Yeah,
it is a false.
About, and I had forgotten to say, except well, after eating.
After
you
eating.
have your lunch, your mother said,
Wait
I'm going
an
to take a
hour."
nap. You can't go swimming because I'm taking a nap and
Yeah.
it's going to hurt you.
Yes.
There's no truth to it.
No truth. You can get cramps anytime.
Okay. I've known several people that have gotten the new shingles vaccine. Is it common to have side effects such as weakness, fever, racing heart rate? Also, can you eat leafy greens if you have diverticulosis? Two questions, really.
Yeah.
Okay.
Well, first of all, the shingles vaccine, it hurts. It's like a tetanus shot.
Yeah, you can pretty much guarantee
You're gonna have
pain
an
at the injection
inflammatory
site.
Yeah.
And some people feel flu-like with maybe a little fever, maybe just achy all over. I don't know about the heart racing. That doesn't
No.
seem quite right.
Well-
but those are your immune system kicking in, I think.
Yeah.
And of course, I mean, if they're doing if it's working, you can feel it, and it might make you nervous,
Yep.
and then your heart rate
Yep.
will go fast. What about leafy greens if you have diverticulitis or osis?
They used to say we had to avoid the
Popcorn.
and seeds
Yeah,
and
any
all this
seeds,
stuff.
yeah, fruits with seeds.
Now they say, no, you can eat pretty much anything you want, and it just has to do with your diverticulosis. And I think it's always better to have more fiber in your diet.
I
Yep,
think the answer
fiber.
is more fiber,
Yep.
more
And-
popcorn.
And have,
More seeds.
And have a bowel movement every day.
Yeah, we like a bowel movement every day.
Yeah.
Okay, and I'm going to take a myth. Many headaches could be helped if headache patients took their pain medicines on a regular and scheduled manner.
This one, I think you need to clarify. If it is a chronic daily headaches, that actually you would do better to not take your medicine regularly and try and get off medicines because
Such as Tylenol.
the
Withdrawal from Tylenol.
Tylenol or ibuprofen.
Can
if
cause,
you can get
yeah.
and it'll just perpetuate that.
On the
so you
other
need
hand, an
to-
intermittent headache, they're
It's
good
fine.
options.
Yeah.
Right. Yes.
Good answer. Sioux Falls, someone is wondering about the benefits of hemp seed oil as it's being touted as a cure-all. I think that's pure baloney.
Yeah.
Anything that is touted as a cure-all, it's the snake oil of the
Yeah.
20th century,
century.
21st century, yes.
CBD oil, which is marijuana oil, which is
Hemp oil.
probably thought of this as hemp oil, has been touted as a cure for cancer, a cure for. People called me and said,
Get on
"You
it."
got to get on it because I've
Yeah.
got cancer. I want you to be cured, and thank you for that concern." But I think it may be helpful for pain,
Yeah.
But
There-
that's
But it's
it.
not going to cure.
but it's not going to cure the cancer.
No.
A Sioux Falls man says, 2 to 3 years ago, my retina detached and I lost much of my eyesight. I can still drive, but I'm also a diabetic and I keep it in check. Hemoglobin A1C down to 5 to 8. How often should I get my eyes checked? Because I don't want it to affect my good eye with my diabetes.
Yearly, at
Well, at
least.
least annually, and then I think it would be up to your
Ophthalmologist.
ophthalmologist.
And certainly,
have
depending upon
further-
your eye doctor,
Yeah.
but at least once a
At
year.
least once a year.
I tell everybody, have you had your annual eye exam when you see a diabetic?
Yeah, there it is. A Madison man comments about CBD oil. I use it every day and it helps tremendously for my arthritis.
Yeah.
Just a comment.
Yeah.
A Sioux Falls man asks, is it true that the prime causative agent of disease is inflammation? That's a really good question.
It is a good question, and
Yes
it
and
might
no.
be.
You know, let's say, why does a smoker get cancer of the lung? because there's chronic inflammation, and the inflammation irritates, and the irritation brings on cancer.
Well, it gets the cells to change.
You have a mutation in the cell that then progresses to cancer. But what did the inflammation cause it? A lot of the diseases we have.
Maybe an oversimplification.
Yeah, but like viruses or bacteria, most of the symptoms you feel are the inflammation associated with that infection.
Right. And is reducing inflammation, like using ibuprofen or whatever herbal
Makes you feel
supplement that
better.
people are, I think the major thing, you turn down the inflammation, you feel better. Is it going to prevent major diseases and prevent cancer? And the answer,
Probably not, but
don't know.
Well, we don't know, right?
Probably not, but
don't know.
maybe not. This has been a very interesting trial.
It's been fun.
This. Thank you for listening and your questions. And now for the winner of tonight's Prairie Doc quiz question. Choose the best answer. Delirium is best treated with 1, hand-holding, 2, anxiolytic like Ativan, 3, major tranquilizer like Haldol. And the answer is Zeigler's?
Hand-holding.
There we go. It works for me.
That was good. And the answer is hand-holding. Sometimes a personal touch is better than a pharmaceutical answer. It was Toby Tunender who answered the question. I hope I said that right, Toby, who answered the question correctly. Thank you for participating, and a book will be in the mail to you soon. We'll be right back after this.
Have you heard? The Prairie Doc has a radio show. Listen to your local South Dakota radio station for Prairie Doc Conversations. This program features physicians and other health professionals discussing various medical topics important to you and your family. Ask your local radio station if they broadcast Prairie Doc Conversations.
Thank you for listening. Until next time, stay healthy out there, people. It was June 10th, Old Settlers Day in De Smet, South Dakota, and the carnival was in town. As a 5th grader, I had been doing odd jobs for a month to save money for that day. For the price of 25 cents, I filed through a trailer to see a real alligator woman, half human, half alligator. Of course, it was fake. Sitting on a table, there was a dried up, stuffed alligator body connected to a live human person's head who was chatting with us. The table had mirrors to cover the hollow box that held the woman's body underneath. It was an amusing ruse, a trick, an intentional untruth that benefited the marketer, exactly 25 cents per viewer. That was, by definition, disinformation. Here's another example. 10 years ago, a telephone scammer got a hold of my contacts list from my computer and began asking friends to wire $2,000 to France to help me get home. It was a fraudulent effort to steal money from my friends. More disinformation. Misinformation is different. Misinformation happens when people believe some ineffective treatment helps or effective treatment harms, and they spread that misinformation. For example, in the 1980s, we noted that people who were having heart attacks had more premature ventricular beats or contractions, we call them PVCs, and these people were more likely to die. Researchers found drugs that suppressed those PVCs, thinking to save lives. It took about 10 years to discover that those drugs increased deaths rather than lessened them. We thought we were doing right, but we're harming people instead. That was misinformation. Another example is telling people to avoid vaccinating babies to prevent autism. This is spreading misinformation. I did the same thing in the 80s when I encouraged parents to place their babies on their bellies to sleep, thinking to protect babies from inhaling drool. We later found that babies sleeping on their bellies had more sudden infant death than those sleeping on their backs. We were misinformed. Bottom line, 1. There will always be people who will tell intentional untruths in order to profit themselves and to take easy money from trusting souls. We need to be watchful for alligator women. Marketing is not science. It is meant only to sell something. Corporate profit justifies to some people the right to tell untruths. 2, we must be humble enough to change our minds. There will always be myths that seem true, but when held under this careful scrutiny of science are wrong. 3, seeking and telling the truth is always the right thing to do. Well, a big thank you to our guests, Dr. Zeigler, Dr. Candace, and Dr. David Zeigler, for volunteering and traveling to come to our studio at Yeager Hall on the campus of South Dakota State University. Taking down the myths that surround medicine is an important mission to improve the health care of us all. Thank you both very much.
It's been great
Well,
being
thank you.
here.
It's been fun.
The flu season is up and running, folks. The latest data from the South Dakota Department of Health reports widespread activity with 571 confirmed cases, 78 hospitalizations, 1 death at least, something like 7 or 8 million people in the United States. The importance of vaccination cannot be overstated. You understand if you watch this program tonight. If you haven't already, please get your flu shot. It protects not only yourself, but the family and friends around us. Well, that does it for tonight. From all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people.
Few things are scarier than the thought of being debilitated by a stroke. What are the warning signs? Can we do anything to prevent them? A stroke of bad luck. Next time, On Call with the Prairie Doc.
Hello to all. I am Dr. Tom Luzier, a practicing allergist in Aberdeen, South Dakota. Born in Kansas, I embraced the diversity of South Dakota. This diversity comes with a price: limited healthcare resources and information. The Healing Words Foundation, through Prairie Doc, provides an open, online, interactive, public broadcasting format for reliable health information. As a member of the Healing Words Foundation Board, I am asking you please to join me in support of this work, which is funded entirely by donations from you. Please consider making a personal or corporate gift to Healing Words Foundation, a 501c3. Go to prairiedoc.org and click on the donate button and make a valuable contribution. Thank you.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
And by the South Dakota Foundation for Medical Care, the medical quality improvement organization for South Dakota.
And with the ongoing support of these individuals and institutions,
Brookings Health System,
Ophthalmology Limited,
American Academy of Family Physicians Foundations, and South Dakota Academy of Family Physicians.
Avera Heart Hospital,
Dakota Allergy and Asthma,
CoBank,
Fishbeck Financial Corporation,
Vance Thompson Vision,
Urology Specialists,
Brown Clinic,
Black Hills Medical Society,
Aberdeen District Medical Society,
3rd District Medical Society,
7th District Medical Society,
Dakota Bank,
Orthopedic Institute,
Physicians Care Sanford Clinic Community Service Committee,
Aberdeen Asthma and Allergy,
and Swiftel Communications.